We're going to talk about concept number 25, and this is infection. And what we find is that pathogens, if you recall from your anatomy and physiology classes, are usually found on the skin, lining of our respiratory tract or respiratory system, gastrointestinal system, urinary tract, our mucous membranes, the eyes, and the mouth. And for an infection to occur, remember it has to find a susceptible host. This is that warm, dark, cozy place that it likes to find, and it's a weakened area in the body. And when it goes to that area, it likes to invade, and once it finds that home in that invasion site of that host, it likes to start to multiply, and this is what's going to cause the disease or / the infection. So when we're thinking about this, we want to think about patients and identify those patients that are most at risk. We also want to learn to recognize signs and any kind of symptoms that we could see of an infection and figure out ways of treating and how do we manage that infection. So that way we have a greater understanding on how to take care of that patient. So briefly, here are the goals for this concept for this presentation. So here's a nice, brief, direct, to the point definition. So please take a moment to read through this. Now I want you to put on your thinking cap so you're ready for class, but we divide pathogens into categories. So you can see here in this pie-shaped graph that they have the classification of the causative microorganisms that cause these infections. So please make sure you go through and look at this and be able to recognize the pathogens and see if you can come up with some specific examples of these types of infections. And to give you a hint too, they also have a table 25.1 in your Giddens book. The main pathogens we're going to look at in our exemplars for this book is going to be MRSA, C. diff, and urinary tract infections. So see if you can find out what category they fall in. Here's some descriptors that we use for the different types of infections. So one of those is location. Is it a localized infection, which might be, let's say you cut your finger and it's a dirty cut and you don't really have time to clean it, and you kind of let it go and forget about it. And when you start to form an infection, it's just right there in that area, so you know to treat that. Versus an infection that becomes systemic. In other words, it spreads and gets into the blood system and starts to affect your organs. So there's the difference between those two. When it comes to duration, we may have an acute infection, might be something that, let's say you get a virus, a cold, and say it only lasts for a day or two. It just came up on you and it went away. Versus a chronic infection, and these are people who have chronic, long-lasting infections that they've had for years. Let's say someone's had a chronic kidney infections or urinary tract infections for years, and it's just something that keeps coming on, and it's chronic, so it's lasted over 6 months. The source, hospital-acquired infections or versus community-acquired. Your hospital-acquired infections are infections that we hope that we can keep from our patients. This is MRSA, VRE, C. diff, coming from the antibiotics that we give for our patients. UTIs, those are more of your hospital-acquired infections, whereas your community-acquired are those that are the infections that people just get out and about in the community. One of the worst places I always think to say is go to the grocery store or Walmart or someplace like that, start pushing a buggy. Can you imagine all the bacteria and the infections, different types of infections people get just from handling that bar on that buggy? Also, too, we have primary infections versus secondary infections. And a primary infection, of course, is pretty much like the definition says. It is an infection someone gets. let's say someone starts off with a cold, and then it goes on to maybe bronchitis or pneumonia, and that would be the secondary infection. So I'm not going to go through all of the anatomy and physiology because you should have already had this in anatomy in your physiology courses. But we want to think about the lymph system and how it works and the cells, our immune response, and the types of immunity that we can receive either by having the infection or we get shots. We also have ways to protect ourselves against other infections such as masks and using our protective equipment. So please make sure that you go through and review that section in your fundamentals book or in your concept book, whichever one you want to use, going back and looking at the anatomy and physiology of an infection in our immune system. Here's our famous chain of infection, and you're going to hear about this a lot because the best way to prevent an infection is to break the chain. So you have a pathogen and it's looking for a susceptible host, and it finds a little reservoir and says, this might be it. And so they have a little portal of exit, which is from the reservoir, and it goes in and says, okay, I'm ready and I'm waiting. And then it has a mode of transition, and this is how it gets into the susceptible host. And then that portal of entry, that could be the eye, the nose, the mouth. Kids are very susceptible because they're always touching everything, and then they put their hands in their mouth or a finger in the nose, or they rub their eye, and that's how they get that entry very quickly. However, you can have entry points, say for a UTI, E. coli, someone not wiping properly, a female, after having a bowel movement, or let's say someone has a cut and they don't keep it closed, or they have dirty fingernails and they have something and they've been scratching and they open it and the dirt under the fingernails enters into that susceptible host. The key thing is making sure our host is healthy so they are not susceptible to infection. So we'll talk a bit about that in your classes and in your skills lab, I believe. Here's an example of a schematic about the process of infection, how interactions of the host, your pathogen, and the environment, and how it all works together. And so this is on page 243 in your Giddens book. So please take a moment just to look at this. It's really important because we understand that the epidemiology, which is the study of infections. We look at the manner in which a disease is going to spread and how it spread through groups and populations, and we use this information to help control these populations. And so when we're looking through, looking at our host and our environment and the parasite, how is it getting into the host? Where is it living? And how is this happening? So when we look at this process, think about, okay, I have a host and what's going on with my host, but I also have this parasite. How does it live? What environments does it like, and then how is it going to get into that host? And you will see where things will overlap here in your diagram. One of the things we think about is the bacteria, how it invades, and the immune process. So we look at the lymphocytes, which are our B lymphocytes. They're actually activated, and so they start to produce these antibodies going, whoa, wait a minute, we have a foreigner in here and we got to get, take care of ourselves. We got to protect, our home. And so the T lymphocytes are then also activated, and they result in the phagocytes, and they're like those little Pac-Man guys that go around and they try to eat up all the infection. And then we have what we call the complement system, and this is going to be activated, and it's going to just help the whole kit and caboodle, help our whole response system. And then bacteria is also going to start to release what we call these toxins known as endotoxins and exotoxins. And what they're trying to do is they try to damage the cell that the host is using to protect itself. And so we have this battle that goes on. And so this is why it's so important for the host to be healthy and not be, a favorable site, but also too that we get the correct medications and different ways to protect ourselves to prevent this infection from spreading. So one of the consequences of infections, if they are not controlled, they can actually lead to a more what we call septic shock. And this is the body can no longer protect itself any longer. It's used up all its reserves, and so it affects our vascular system, our renal system, our nervous system, and our respiratory system, and it just overwhelms the body. And so this septic shock can lead to actually all these systems starting to fail, which can eventually lead to death. So this is why we don't take infections lightly. So when we think about infections that are severe, maybe get to the point where they don't respond to therapies because of all the antibiotics that we've been using over time, or maybe it's never been treated, it challenges our bodies and it says, you know what? I can't restore myself anymore. I cannot compensate. I cannot fight this off anymore. And so this is what definitely leads into that septic shock and leads to the failure. And what we end up seeing is with the symptoms of failure is that we start to see low blood pressure, which is known as hypotension. We see faster heart rate because the body's trying to pump the blood through the body faster. So we'll see tachycardia, which is fast heart rate. We'll see the patient breathing faster, trying to get oxygen. So that's the tachypnea. We will also see either oliguria or anuria, which is low or no urination. We'll see hypoxia, lack of oxygen through the body system, hypercapnia, and we'll see seizures and eventually coma, and then this can lead to death. And here's a little schematic. If you're a visual learner, you may want to look at this and see how it affects the body, just what I said, but just written in a schematic form. So let's look at some of these risk factors. And so we look at the populations that are affected. And so this is any population. It doesn't scrutinize by age, gender, race, your socioeconomic status. Populations, though, that are at the greatest of risk are the very young, the poor, uninsured, and areas where the infection is more prevalent. So when we're looking back at some of this information, you see the uninsured or underinsured, of course, their consequences are not being able to have sufficient health care, may not be able to afford vaccinations or have the ability to get free vaccinations. Or to be able to travel to where they can get those. The other thing is that we're thinking about is travel may be prevented because of where they live, and they may not have a bus or a van that comes out with health screenings and treatments for infections. They may have a difficulty purchasing medications and buying food and food supplements. In some areas, they may not even have electricity to be able to refrigerate foods properly. And so several different things come into play that we really need to take into account, because lots of times we kind of overlook some of those areas at times. Okay, so we're going to move on to the next goal, which is recognizing when a person has an infection. When I think about primary prevention, this is preventing the infection from even happening. So some of the things that you're going to look at is vaccinations. And then you want to think about across the lifespan and what vaccinations individuals need at certain times of their life, such as infants, young children and toddlers, kindergarten age, then you get school age, starting college, and then you move into the elderly. So make sure to look at the CDC website and what we'll do is go over that in class, so make sure you kind of look at the recommendations for vaccinations. Another thing that you want to pay attention to is hand hygiene. And personal hygiene and food hygiene. Personal hygiene is just keeping clean every day. This goes for the teeth and the mouth, washing the skin, preventing any kind of infections from entering through the skin. Also, too, you want to think about food hygiene, making sure that food is prepared properly and is stored properly. The other thing is when we do patient care, the number one thing to prevent any kind of infection, you're going to hear about this over and over and over again, and this is hand hygiene. And this is washing your hands before you touch a patient and after you touch a patient. When you're gloving, even though you've worn your gloves, you take those gloves off, you wash your hands. And so you're going to be expert hand washers by the time you're done. And you can carry that on into practice. The other thing you want to think about is how do we prevent infections, and that is controlling our good control practices. And this is, again, hand washing and making sure things that should be sterile stay sterile. Everything is clean. That we know how to properly use equipment, insert a Foley, insert a needle, whatever it is, making sure that everything is clean all the way down to the sheets and the gown that our patients wear. In class, we're just going to discuss briefly, because you'll be doing a lot of this in your skills lab, but we're going to talk about hand hygiene and all the hand hygiene measures. And we're also going to discuss other ways to make sure that healthcare professionals stay in compliance with these practices, and what are some possible solutions. Some of the interventions that we look at is antimicrobial therapy, and this is making sure that we're using the correct treatments to prevent or to treat an infection, whether it's an antibiotic, antiviral, or any other type of antimicrobials. So it's very important that we use those labs and our diagnostic studies to help us to use the appropriate type of antimicrobial. Another thing that we're going to do as well is look at rest and comfort, making sure that our patients get plenty of rest so that they're strong and that they stay comfortable so they're able to rest properly and to get an amount of sleep to help their body to heal. We also think about nutrition and fluids. And so, sometimes we have to use replacement therapies and making sure they have plenty of electrolytes. We may have to hang a bag of electrolytes for them to get. So if someone has been dehydrated from either diarrhea, vomiting, or they've had a high fever, so they may not have had a proper nutrition. But the other thing is, too, plenty of fluids. To make sure that the body is working properly and is able to fight off disease. And then the last one is disinfection of the physical environment. And this is knowing how to properly clean equipment, that the rooms are cleaned, that we clean the beds, the railings, the tables, not putting pee or spittoons up on the table, and then I'll have them feed, eat, or put in equipment that we're using on them on those tables. So always make sure they're wiped off. Last but not least, we're going to look at some of the other concepts that interrelate with infection, and one of those is immunity. And this is where we provide the body a protection against pathogens to keep them from entering the body. Our immune system is always going to be our first line of defense, and so it is our main method of how we protect ourselves and from those invading pathogens. Another one is inflammation, and this is part of our body's response to any kind of foreign antigen that's trying to enter our body, and so it's our defense mechanism. And so you'll see the inflammatory response happening when we see the pain, the swelling, and the redness around a site. Another one is tissue integrity. So to avoid infections, we need to keep the skin healthy, our tissue healthy, and not susceptible. So we need to make sure our natural barriers are in place and that they're strong and not vulnerable to diseases. Another one would be stress. Stress is physical, emotional, and environmental stress in our health professions terms. And so it challenges our immune system and our bodies start to break down. Think about the times that you've been under a lot of stress and you end up getting sick because your body is broken down and you don't have the defense mechanisms in place. And so it's easier for pathogens to invade if we're not taking care of ourselves properly. And finally, nutrition, since we just talked about that a minute ago, is maintaining that good nutrition and rest to help our body to respond to infections and to help to ward them off or fight them off and to support our immune system. So that is infection concept in a nutshell. And so please make sure that you look over the case study, and we're going to again talk about a couple of exemplars in class, and that's going to be C. diff, Clostridium difficile, urinary tract infections, and MRSA.